I am Dr. Satyaprakash. I am the Chief of Psychiatric Division at NeuraXis Care based at National Heart Institute, New Delhi. Today I would like to share a few words about depression. When I say depression, I am referring to the depressive disorder. Very often depression is confused with day-to-day sadness. Day-to-day sadness and depression are certainly not the same. Depression, variously known as major depression, depressive episode, depressive disorder, they are different shades of a similar kind of a phenomenon, is different in many ways from the day-to-day sadness. For instance, the sadness associated with depression is described as persistent and pervasive, which means that it's there most of the time and it is there across different life circumstances, scenarios, etc. Then there are many other additional symptoms, if you will, of depression, such as lack of pleasure in previously pleasurable activity, extreme fatigability, low self-esteem, low self-confidence, negative thinking, pessimism, poor concentration, poor memory, suicidal ideas, attempts, etc., change in body weight, change in appetite, change in sexual functioning, and many more. So these have to be present for a certain duration before we can call or diagnose it as a depressive disorder. Without getting too much into the details, the crux is that qualitatively as well as quantitatively, the symptoms of sadness are quite different from your day-to-day sadness. Now, how do we intervene or treat in a case of depression? Many different strategies exist depending upon the severity and the nature. Before we deal about the intervention, a few words about the cause. The cause is multifactorial and therefore the interventions will also depend upon the relative contribution from the different domains. So a very useful model is the biopsychosocial model. Biology, psychology and social circumstances all come together to produce most of the psychiatric conditions, and depression is no exception. Biology refers to genetics, hormones, neurotransmitters, chemicals, etc. Psychological aspects refer to learned patterns of thinking, feeling and behaving that we have learned over the years based on different life experiences, and social refers to the life circumstances. So all this come together, abnormalities in all different spheres come together to produce a depressive disorder. So if the depression is mild, a different set of interventions may be recommended. If it's severe, a different set of recommendations may be recommended. In milder cases, for instance, exercise, meditation, yoga may be of value. In mild to moderate cases, in addition to the exercise, meditation, etc., psychotherapy may be also of value. In fact, in milder scenarios, one should not be prescribing medication. Psychotherapy is the recommended strategy. Psychotherapy is of many different kinds, and we will not get into the details of that here. In more severe cases, medications are typically the option of choice. Besides medications, there are also brain stimulation methods that have come up in a big way. Different kinds of patients might need different kind of interventions, and brain stimulation is also one such strategy that's reserved for a certain subset of patients. Brain stimulation may be things like electroconvulsive therapy, recurrent transcranial magnetic stimulation, deep brain stimulation, etc. So recurrent transcranial magnetic stimulation is a non-invasive method. Electroconvulsive therapy involves a little bit of anesthesia and a brief procedure. Deep brain stimulation is a neurosurgical procedure that is also useful for a certain subset of. So in conclusion, it's important to understand that depression is different from everyday sadness. Depression may be present in as much as the WHO estimates about 5% of the population, adult population, suffer from depression. Depression leads to significant impairment in quality of life, loss of productivity, and many different things. And therefore, it's important to intervene early and properly in case of depression. So those were a few words about depression. Thank you for being with me. Thank you.